In dogs, the knee joint is called the stifle joint. It is formed by two long bones, the femur and tibia, a small bone, the lateral fibula, a cartilage pad on the outside of the joint, the lateral meniscus, a stabilizing ligament, the cranial cruciate ligament, a cartilage pad on the inside of the joint, the medial meniscus, another stabilizing ligament, the caudal cruciate ligament, a tendon connecting the quadriceps muscle to the tibia, the patella tendon, which has a small bone embedded in it, the patella. When the dog bears weight through the stifle joint, forward movement of the tibia relative to the femur is prevented by the cranial cruciate ligament. The cranial cruciate ligament is the main stabilizing ligament of the joint. It originates from the femur and inserts on the top of the tibia, the tibial plateau, between the medial and lateral menisci. The caudal cruciate ligament originates from the femur and inserts on the back of the tibial plateau. It prevents backward movement of the tibia relative to the femur. The cruciate ligaments are so called because they form a crucifix when viewed together. These ligaments move independently as the stifle joint is flexed and extended, although their movement is coordinated to maintain the position of the tibia relative to the femur and thus keep the joint stable. When the cranial cruciate ligament is ruptured, the stability of the joint is lost. Rupture of the cranial cruciate ligament means that the tibia can now move forward relative to the femur. The abnormal forward movement of the tibia relative to the femur may result in the medial meniscus being injured by the femur as it is attached to the tibia at the back of the joint. In contrast, the lateral meniscus is attached to the femur at the back of the joint, which means it can move with the femur rather than being injured.